when will I start to see cataract surgery results? Following cataract surgery, in the vast majority of patients, I don't cover the eye with a shield, and so immediately after surgery the vision is very blurred and misty. And that will persist for the rest of the day, but the following morning patients are beginning to perceive an improvement in their vision. And by 48 to 72 hours, the vision is really beginning to become clear. And many patients feel that their vision at that time is good enough to drive. The other thing patients should be aware of is that this is an operation. And although after 48 to 72 hours you may have most of your vision, perhaps 90% of your vision, it can take another 4 to 6 weeks for the vision to finally settle. Many patients will see me a week after surgery and say, "It's not quite right yet, Mr. Morrison." And I always say to them, well, if you have knee surgery or hip surgery, you don't expect to be running a week later. And similarly with eye surgery, it does take time for that vision to really crisp up. It's almost as if you've got the gross picture, but it's not quite finely tuned. That's not the case for everybody, but it is the case for many patients, particularly those with multifocal lenses, where there is an adaptation period to these lenses. In a patient who's had multifocal lenses, it may be 6 to 8 weeks before the vision fully settles and the full benefit of surgery is there. The other thing to be aware of is, following surgery, the eye needs to heal. And so there's a tiny nick in the eye at the time of surgery. And so the eye can feel dry, or there can be a foreign body sensation around the eye, and again that can take 6 to 8 weeks to settle, particularly if somebody has a pre-existing dry eye and has been using dry eye drops before treatment. If they have been using dry eye drops before treatment, it's very important that they continue to use those after surgery, as well as the antibiotic drops that they're given.